So thanks everyone for joining this breakout session. Pablo and I have had the opportunity to work with a number of different health departments in the US and around the world on the COVID-19 response. And so we just wanted to share some of our experiences briefly and then have time for some discussion. So working with health departments on this outbreak has been a really interesting experience. We've been fortunate to have the opportunity to kind of work on these issues in real time and try to have our work really shape and inform policy and response and hopefully be helpful for controlling this epidemic. But as you can imagine, trying to translate science into policy has a number of challenges. And so we wanted to kind of describe some of the work we've been doing and also some of the challenges that we've come across in trying to do this work in real time. And really, as Bill was talking about, kind of communicate our findings in ways that are actionable. So some key themes when Pablo and I were discussing our work that came up were the issues of speed. So, you know, the quicker you can get answers to questions and responses, the better in terms of the outbreak, but usually science moves at a slightly slower pace. So trying to keep up with the speed of the outbreak in terms of the research has been an interesting experience. Also challenges with data availability and what to do when data is limited, and also when you just are given different amounts of data for answering the questions that you're interested in. And then one of the biggest things for us has been thinking through how to communicate uncertainty. Oftentimes policymakers, you know, want one number, one answer, and that's not always possible to give. So thinking through kind of ways that we've addressed these challenges and the opportunities that they've presented. So with that, I'll turn it over to Pablo.
Yes. Thank you, Rebecca. So in my case, after working in the beginning of the outbreak with some colleagues mostly on importations of COVID, I began to support part of the team that was responsible of outbreak response in Spain as part of the Ministry of Health. And one of the activities, probably the most critical in terms of output, was to try to help in monitoring transmission dynamics to support public health decisions, which basically meant in that situation in Spain where the outbreak was spreading, or the disease was spreading so fast, increase the social distancing in the beginning and then decide if social distancing should decrease. And here it combined two of the challenges that Rebecca was speaking. One of them was that they kind of need support, and at that moment, so we had to develop very fast modeling approach to help in monitoring transmission. The other thing was that the availability of data that we had was extremely limited, mostly because the outbreak had almost collapsed the health system, including surveillance, within 1 or 2 weeks, but also because it is something very different compared to other things that we've faced before, either endemic transmission or epidemic that was never to this level of burden. So as an example, what we had is something that's probably homogeneous in other settings, which was aggregated number of report cases, by date of notification or by date of report, which is rather uninformative. And we had a small subset of cases where we knew the date of symptoms onset and the date of report. So the challenge was to provide within 3 to 5 days a solution to this issue, which was getting some informative data or estimations into how transmission was going on. And the output of this approach could be very hard because, as I said, it was trying to support decisions at the highest level in Spain to whether increase social distancing measures or decrease them. So actually, for the first challenge, we failed. We were not able to implement a model that was informative. So Spain had to move towards the highest level of social distancing that the country could afford, given the reported cases, hospitalization, and intensive care cases that we were having. But we were able to achieve reasonable results with the model, and that model has helped to track how transmission was working, and also how social distancing measures were likely to impact the transmission. So in the next slide, I put 3 examples or 3 parts of the analysis that we were doing. The first slide shows the different levels of reporting that we had in different regions in Spain. The second one is the output of the model, which implied both imputation of missing data, but also correcting and adjusting for different bias, including the right truncation of reports, but also the delay on reporting. And the last slide is the one on the bottom. Sorry, not the slide. The picture. The one on the bottom is an approach that we try to monitor transmission, similar to what Stephen and Christine presented. This R effective or effective reproductive number through time, and trying to see how the different social distancing measures impacted transmission. It's still something that it's ongoing. We are still working with the government and improving the model, and also it's a challenge to convert this strategy into something that can be publicly available, and also something that can be peer reviewed as a scientific work, accounting for all the limitations. So it's still something that we are putting a lot of effort. I think that's it, Rebecca.
Thanks, Pablo. So I'm going to talk briefly about some work I did starting at the end of January this year with some health departments in the US. And I think this is a good example of thinking about the amount of uncertainty that we were talking about earlier. So at the end of January, some people from health departments contacted us and asked, how can we think about the question of how many cases there might currently be circulating in our city, given that we aren't testing many people at all and testing is not widespread. And so there's still a lot now that we don't know about SARS-CoV-2, but we knew even less back at the end of January. And so we worked to build a model to think about how many cases might currently be circulating in a city, but we wanted to incorporate this amount of uncertainty. And we identified 6 key parameters that we felt had a lot of uncertainty and could really affect the trajectory of an outbreak and how many cases there might be in a city. So these 6 parameters were the number of introductions that had occurred in the city. So we were hoping to incorporate travel data at this point, but we didn't have it at that time. So we allowed that to vary from 1 all the way up to 100 introductions. Thinking about what proportion of infections were symptomatic, whether someone with a symptomatic infection would self-observe and limit their contacts. This was before any social distancing measures had been put in place in the US. The basic reproductive number, we allowed this to vary from 1.8 to 3. The relative reproductive number for asymptomatic infection relative to symptomatic infection, which I think is still a pretty big unknown. And then also the proportion of transmission that occurs pre-symptomatically. So the link on the right takes you to a web page where you can play around with those different parameters and see how this affects the potential course of the epidemic. But this was one way that we thought about for trying to kind of capture this level of uncertainty and give a range of possible numbers of infections. And I think with the idea being that as more information became available about these different parameters, the number of possible combinations could be decreased to a more sizable number. And then since then, I've been working with some health departments on analyzing and interpreting their data, which comes with its own set of challenges. It's hard to know, given how much testing has changed over just the past couple of months, how to interpret increases in positive cases. Was that just due to increased testing, or is it due to increased transmission? And then also trying to think through different measures of how do we know when this is getting better? Is social distancing working? So that's just an example of some of the work that Pablo and I have been doing. And we really wanted to take this opportunity to open this up for discussion and hear what other people have to say. So with that, I will stop sharing my screen and take any questions that people have.
Hi, this is David Smiley with the Miami Herald. Thanks for doing this. I know I've seen data from the school related to the state of Florida, but I was curious if you could speak to the extent of cooperation or work that you've done with the state health department and whether you guys continue to be in any kind of regular conversation with them.
So I haven't done any work myself with the Florida Health Department. The COVID Mobility Network, there's another breakout session that talks about mobility data, but I believe we have some people from that group that have been working with the Department of Health there. The idea behind that project is to see whether we can use mobility movement data from different tech companies like Facebook and Camber and others to see whether we see changes in movement over time. You would think that the movement would decrease if social distancing measures were decreasing people's movement. So I know people from that network have been working with them, but I have not personally. Other questions or thoughts? Pablo, did you want to talk about your last example that we had?
Okay. Yeah, sure.
If there are no other questions.
Yes. Well, maybe we are also reachable by email in case people had questions that come later. Well, this is just another example of the challenges that we had working with the government in Spain, which was we had to put together a clinical trial and design a clinical trial for healthcare workers, and that was because healthcare workers are cornerstone for the response, and at the same time, they are the highest, or probably one of the highest risk populations. So we had to design a multi-centric with more than 60 sites and more than 4,000 individuals clinical trial, which we did in 1 week, and also we had to include a lot of outcomes and potential outputs that will be also informative for disease clinical and epidemiological features. So it was another example of the extent of the level of speed and the effort that we had to put to develop such an intervention, which will typically take months, if not even a whole year for designing. Yeah.
Great, thanks. Are there any other questions or comments?
Well, I guess we are not very used to this type of conferences.
Oh, there's a question in the chat. The level of communication between the US federal, state, and state health departments is easy to share data. Is everyone generally on the same page? That's a good question. I think it really, yeah, I think from my experience working with the individual state health departments, I've had a good experience and everyone's really willing to share data and work together. I haven't worked at the federal level as much yet. And I think it also has been changing starting at the end of January. It definitely seemed like different states were at different levels of the response and thinking about this as it was just starting to become an issue in the US. But we've seen that change over time as it's continued to spread. That's a good question. Pablo, when did you start working with Spain?
I think 2 weeks and a half now. Yes. 3 weeks, yeah. Yeah, there has been a lot of challenges I think everyone has been trying to facilitate, but there's no real framework for this type of collaborations. And I think also linking to the issue of the data availability, it's been depending a lot in the capacity of putting things very fast. Like in Spain, because this is sensitive data, especially if it's individualized, you have to be sure that that's they identify. In Spain, has been very challenging to facilitate that data sharing, not just to the public, but also within the scientific community. I think in the States has been a little bit easier, or I think has been more facilitated. But still, I think there's a lot of information that needs to be on. And like one of the issues that we were having is this difficulty on making forecast or estimations with cases by report date, which is what most of the places are reporting, and it has huge implications. What are your conclusions?
Yeah, I've been thinking a lot about kind of what this will mean for kind of health departments moving forward and how surveillance systems will get updated and sort of what changes will be made kind of in the future, looking back, and what systems we wish we'd had in place during this outbreak.
Well, I think at this point, if there's no more questions, we are available by email. Do you want to say goodbye, Rebecca?
Yeah, if there are no other questions or comments, yeah, thank you for joining this breakout session.
Okay. Bye, everybody.
Bye.
Have a good day.